Welcome back to Sleep Better TV. I'm Scott Drake, and my guest in studio is Cynthia Levy. She is one of the founders of Dental Sleep Today, and she is a dental consultant. Cynthia, great pleasure to see you. Welcome back. What makes you different from other dental consultants?
I think what makes me different is that I actually don't come from a hygiene background or a clinical assistant background or even the front desk background. I came to dentistry as a result of starting to help my husband in his practice. And I think that my focus is a little bit different. It's a little bit broader. There are so many different aspects to a practice that need attention and management. Dentists have very little business background, very little business training. Most dentists I know don't want to deal with staffing issues. And there can be so many different things that need attention in a practice that my approach is to go in and look at the entire practice. Is it marketing? Is it staffing? Is it a lack of attention to the business detail? Setting them up on systems that I think can help their efficiency. I'm a very hands-on consultant. I frequently go into practices that have worked with consultants in the past. You know, the person who shows up once a month, spends an hour or two in your practice. I'm a very hands-on person. I work very closely with the staff, and I always try to have a point person that can help implement the changes and the suggestions that I'm making. That's what's really important, because I know for a fact, my husband has had dental consultants before. We've worked with great consultants. I've learned from them as well. And I know what makes a good consultant and what doesn't make a good consultant. And there's so many times that a consultant will work with a practice and work with a dentist, and nothing ever gets implemented. Nothing gets changed. It's frustrating for the dentist, it's frustrating for the consultants, and I find I don't like to work with contracts. I don't have a contract. If we work well together, we continue to work well together. If it doesn't work, it doesn't work. It has to be a two-way street.
Cynthia, one of the most difficult things for dental professionals to handle sometimes is marketing themselves. What kinds of tools do you offer?
I take a very critical look at their online presence. I have companies that I work with that have a lot of expertise in web design, in SEO, and search engine marketing. I've worked with a radio consultant for about 5 years. We use radio very effectively. It only works for certain procedures, but we can use it very effectively. And recently, everyone's gone away from mailers and mailings, etc. It's actually making a resurgence because there are so few dentists doing it anymore that some of my clients I'm actually recommending a consistent mail campaign. What I find happens with most marketing is that the dentists don't do it long enough or as consistently as they should. It's sort of as I have a few $1,000s this month, so I'll throw it at marketing. If you don't market consistently, keep the money in your pocket because it won't work. And if you're patient and you continue to devote a very specific percentage of your budget to marketing, it'll work. So it's really about consistency.
And I'm sure you've seen a lot of dental practices in your career. What are some of the opportunities that they typically miss?
You have to have a professional environment. It must be clean, up to date. It's amazing some of the practices I walk into and what I see. And that doesn't take much. It doesn't take much to change that and to turn that around. I think the biggest problem in consulting that I have found through the years is that dentists wait too long to ask for help. They'll spend a lot of money on a new piece of equipment that they think is actually going to bring a patient in the door. But they won't spend money on marketing, and they won't spend money on a business consultant, and they won't bring someone in to help. And that, I think, is the hardest part for me as a consultant, is sometimes I walk in and I realize it's too far gone. The money's not there to market. The money's not there for continuing ed. It's not there to improve the facility. So, it's almost like, what do? You've gone down the hole too far. So I think the biggest thing, if you're thinking about a dental consultant, is that, do it sooner rather than later. If you've got issues, bring someone in and correct them. And it's just like preventive dentistry. If you go to the dentist twice a year and you have healthy teeth and healthy gums, you'll probably prevent a lot of problems. It's no different from a dental practice having issues. Nip it in the bud.
Cynthia Levy is my guest. She's one of the founders of Dental Sleep Today, and she is also a dental consultant. I'm Scott Drake. Thanks for watching Sleep Better TV.